Hi, welcome back to our channel here at Antai Hospital, and in today's video we'd like to talk about PCOS and menstrual irregularities. Now, by far the most common symptom that we observe when we talk to patients who are suffering from PCOS. Before we try to do diagnosis, we will ask about symptoms about their menstrual cycle, because by far it is a very common symptom. It's considered a primary symptom for many PCOS patients, and how it manifests itself is that these women do not have regular menses cycles. So what is a regular menses cycle? There are a few ways to defining regular menses cycle. So for typically we will say that normal menses cycle will manifest itself in up to 13 cycles per year. Now, if you have 12 to 13 cycles per year, if you have menstruation of 12 to 13 times per year, then you're considered normal or in the healthy range. But this needs to be every 28 to 30 days. So do some tracking. If you do track your menses cycle, do some calculations. Do you hit 12 to 13 and almost every 28 to 30 days? And if you do hit this range, you're considered healthy, and PCOS is not likely something that you're suffering from. But most of our PCOS patients, they do not pass this qualifying test at all. Some of them take 45 to 60 days for one cycle, and many of them have only 5 to 6 menstruations per year, and that is incredibly irregular. So if you are within this range, there's something definitely wrong with your cycle, and PCOS is usually the underlying cause. The next step in doing diagnosis to confirm your case is that we will either do a blood test to quantify your blood testosterone levels, or we will do a ultrasound of your ovaries, and then we would immediately see multiple follicles maturing at the same time, and we can confirm that you're suffering from PCOS. Now, these patients, when they suffer from menstrual irregularities, their normal response is to go to a normal clinic, get prescribed with some birth control pills, and then seemingly they believe that their menstrual irregularities have been treated because they start to menstruate again every single month just by using these pills. So why should I need further treatment? Now, if your doctor doesn't explain this to you, let me explain this to you. The pills that you are taking for your PCOS is simply treating the symptom. It's stimulating the ovaries and the endometrium to release certain hormones so that the endometrium thickens and sheds. But you must pay attention. This very important part is that know that your ovaries are not releasing any egg cells. So your endometrium, although it's vascularizing and thickening and then shedding every month because you're on these pills, it's a purely external alteration of your endometrial function. It's not happening naturally, and your ovaries are not secreting any egg cells, and the underlying cause is not being treated. This is only dealing with the symptom, but many patients don't know this, or they don't care. And when they start to care is that when they start going into marriage, they find themselves extremely difficult to get any form of pregnancy. They're already infertile at that point because they didn't emphasize treatment early on. When you become dependent on these medications for 2 to 3 years, it tends to cause complete shutdown of the ovaries and releasing ovaries. And then after that, you seek treatment, it may get more complicated, and we cannot guarantee success at that point. That's why you want to quickly get off these medications if you are, and seek surgical treatment. Now, we've already explained at Antai Hospital's channel, our website, we already know the underlying cause is presence of these abnormal testicular tissues. We call them testicular tissues because they behave very similarly to testicular tissues. They are abnormal Leydig cells, only trace amounts, but they secrete high amounts of this testosterone. Although testosterone is very important in ovulation, even in healthy female individuals who have no PCOS, testosterone is very important because it stimulates ovulation. However, for PCOS patients, the testosterone is tenfold, too high. And when there's too high of a testosterone level, ovulation does not occur, and it affects your endometrial activities, and it affects your blood, insulin, your metabolism, everything, even your mental health as well. It leads to severe mood swings, depression as well, and it can affect your fertility and your quality of life. So what we need to do is drop this testosterone level the right way. And how we do that is by removing these abnormal tissues using 3D laparoscopic surgery. This technique is a minimally invasive technique and is highly effective in treating PCOS. You only need to go for this treatment one time, and there's no pill that you need to be dependent on. Although there might be some further supplement treatment that we need you to do, because most of these PCOS patients, they have some other underlying condition. For example, they have PCOS with a naive uterus, or PCOS with a septate uterus, or PCOS with a cervical insufficiency. This all needs to be comprehensively diagnosed and treated. If you only treat one, these people still cannot get pregnant, or they still experience miscarriage. So you need to have a comprehensive treatment. Are there any further problems with the uterus, with the cervix? Are there any problems with their hormone balance? All of these needs to be comprehensively diagnosed, and only we can give you comprehensive treatment, because at the end of the day, we want to guarantee that you experience natural pregnancy, because this treatment comes with a full refund guarantee at Antai Hospital. If you found this interesting, or if you are keen about treatment, please visit the website, get in touch with us today to find out more, and maybe arrange an appointment to seek this treatment today. Stay tuned to the next one, and I hope you found this video beneficial. Leave me some comments down below as well.